Porphyria. Cause and symptom. Possible complication. Treatment. Porphyria. Porphyrias are a group of inherited disorders. An important part of hemoglobin, called kin, is not produced properly. Kin is also found in hemoglobin. Certain musos.
Both natural chemicals that produce porphyrin in your body. Porphyrins are essential for the function of hemoglobin. High levels of porphyrins can cause significant problems. Porphyria mainly affects your nervous system, skin, and other organs. The signs and symptoms of porphyria.
Cause and symptom. Normally, the body produces kin in a multi-step process, and the porphyrins are produced during several steps of this process. People with porphyria has a deficiency of certain enzymes necessary. This causes unknown amounts of porphyrin or related chemical to accumulate in the body. There are many different forms of porphyria, and the most common type is late skin porphyritis. Drought, infection, alcohol, and hormones such as strong can trigger attacks of certain types of porphyria. Porphyria is hereditary. This means that the disorder is transmitted throughout families. Porphyria causes their main symptoms: colic or abdominal pains, and in some forms, excessive sensitivity to light that cause red blisters and scars of the skin post-dermatic. Problems with the nervous and muscular system, sexual mental disorders, neuralgia, dementia. Attacks can occur suddenly, usually with severe stomach pain, food, the vomiting, and constipation. Being in the sunshine cause pain, sensation of the egg, blister as well as running and squint of skin. The visitor health solid of the skin by in the sun can cause pain, sensation of egg, blister as well right and spirit of the skin. The blister are sorry of with scarring or shine in skin color and can the deformation. The urinate might turn red or frog affect and attack.
Autosomal dominant characterized by a deficiency of the enzyme porphobilinogen deaminase.
Acute intermittent porphyria is inherited or passed down from parents to children. It happens because of a problem with protein in the red blood cells that bind oxygen and carry oxygen in the bloodstream.
The application mechanism has because of drugs, hormones,
Treatment. Some of the medication used to treat sudden acute attacks, the porphyria may include hematine administered through a veins, intravenous, analgesic, propanol, the control the airbags, sedative to help you feel calm and less anxious. Other drugs may include beta-carotene, complements to produce photosynthesis, chloroquine in low dose to reduce porphyria level, liquids and glucose to increase carbohydrate levels, which help limit the production of porphyrin. Blood extraction, phlebotomy to produce porphyrin level. Depending on the type of porphyria you have, the provider can advise you about alcohol, about medication, dose, and participate and adults, about skin lesion, about sunlight, and much possibly and sunscreens. With outdoor acts at the rich in carbohydrates.
Acute intermittent porphyria is an inherited metabolic disorder in which lack of an enzyme called porphobilinogen deaminase results in a buildup of porphyrins in the body. It is a rare disease affecting 1 to 5 per million of the American population, predominantly women between 18 to 40 years of age. Patients with acute intermittent porphyria have no symptoms at baseline. Symptoms may be triggered by use of steroid hormones, harmful drugs, and alcohol. Low-calorie and low-carb food and premenstrual hormonal changes may also lead to symptoms in susceptible patients. During the attacks, patients may develop abdominal pain, constipation, muscle weakness, numbness or tingling in the hands and feet, psychiatric disturbances such as insomnia, depression, and even schizophrenia, port wine-colored urine, and seizures and coma. Unfortunately, acute intermittent porphyria often goes undiagnosed. In individuals presenting with unexplained severe abdominal pain, the diagnosis is confirmed by finding elevated porphyrins in urine. Management includes avoidance of precipitating factors, treatment of the acute symptoms, and decreasing the formation of heme and precursors via administering glucose or hematin. Relatives without symptoms can be identified as carriers of the disorder by molecular genetic testing. For more information and a list of expert doctors,
Possible complications. Complications might include coma, gallstone, paralysis, respiratory failure due to weight gain of the thorax muscles, scar of the skin.
A substance called hema. Hema is found throughout the body, especially in your blood and bone marrow, where it carries oxygen. Porphyrias affect the skin or the nervous systems, abdominal pain or cramping, light sensitivity causing rashes, blistering, and scarring of the skin, muscle pain, muscle weakness or paralysis, numbness or tingling, pain